Welcome to a new episode of our podcast dedicated to regulatory affairs and life science. In today's episode, we will talk of the food supplements regulation in Italy. According to the definition of Legislative Decree 169 of 2004, food supplements are foodstuffs intended to complete ordinary diet and constituted a concentrated source of nutrients such as minerals and vitamins and other substances with a nutritional or physiological effect, including but not limited to amino acids, essential fatty acids, fibers and herbal extracts, with either one or more ingredients in their composition in pre-dosed forms. The European Food Safety Agency, the EFSA, stresses that food supplements can contain a wide range of nutrients and other ingredients, including vitamins, minerals, amino acids, essential fatty acids, fibers, and various plants and herbal extracts. In the European Union, food supplements fall into the wider category of foods, and therefore they follow all European regulations on this subject, such as the so-called hygiene package, but are also regulated by a dedicated directive. The European directive has been implemented by every member state into local norms, thus making the food supplement market not fully harmonized. While there are harmonized rules for some ingredients, such as vitamins and minerals, for other ingredients and nutrients there are only national norms. Such norms aim at protecting consumer against any risks related to the consumption of these products. A list of substances which are known or suspected to have adverse effects on health is an integral part of these rules, as well as any consequent restrictions on their use in food supplements. As all norms on safety, the regulatory framework regarding food supplements evolved hand in hand with the consolidation of knowledge and information about the ingredients and effects they can have on our body. It should be reminded that supplements are food products, presenting some peculiarities regarding their forms of presentation, their consumption units, and their preset daily supply. At the beginning of the regulatory history, they were in fact part of the category of food intended for particular nutritional uses, that is, foods intended for infants and young children and dietetic products. Then, Directive 2002/46/EC, implemented in Italy by Legislative Decree 21st May 2004 number 169, introduced specific rules for the category of food supplements, deleting any reference to dietetic products from their definition. Consequently, foods for particular nutritional uses were subject to changes over the years. The first Directive 77/94 EEC was then replaced by Directive 89/398 EEC, included into Directive 2009/39 EC, following several amendments. In 2016, this directive was repealed by Regulation EU 609/2013 on food for specific groups, the so-called FSG. The regulation limited the previous classification. The previous 9 specific categories of products for particular nutritional uses, 3 for foods intended for infants and 6 for dietetic products, were included into 3 types of products: food intended for infants and young children, 4 for special medical purposes, and total diet replacements for weight control. Therefore, over time, the different role of food supplements was acknowledged. In fact, Directive 2002/46/EC provides for that they should complete ordinary diet. To be defined as food supplements, products had to present nutritional features, that is, predefined supply of vitamins and minerals, so that they could be regulated as foods. This theorem posed the problem of products containing other ingredients, such as those containing herbal extracts that cannot be considered as nutrients. Being neither food supplements nor medicine, a different classification was attempted for these products as herbals, but in the end nothing came out of it. However, there were several attempts to regulate the unmeated plants, not only at national level but also in Europe, as shown by the Belfrit project. The issue of food supplement indication had also remained open, as an actual effect can only be claimed by products classified as drugs. The use of claims, that is, specific nutritional and health indications, solved the problem. It is in fact possible to apply to the EFSA for the approval of indications to be reported on foodstuffs, including food supplements. Food supplement market continues to flourish, and it has apparently found its natural setting in the online sales. The regulatory history of these products is destined to evolve in order to harmonize local norms throughout the community to ensure higher safety of these products. Technological and cultural progress in this sector will be certainly followed by interesting novelties in the legal sphere for the protection and benefit of consumers. Thanks for listening to today's episode. If you want to listen to other podcasts, sign up for our channel, follow up on the social media and join us for next episode.